Welcome to this video on slit lamp examination. Here we are showing you an anterior segment photograph of a patient with mid-dilated pupil, and you can see there's some area of capsules over here. So this patient actually had this area of posterior capsular rent, and the IOL had been implanted in the sulcus in this patient. So let's go forward, and this definitely an arcus sinalis, which you can see on the periphery. And on the nasal side, there's some bit of atrophic pterygium, or looks like in that category of sort of thing. So let's go forward and look at the red reflex examination. The other thing which you want to see is there's debris moving in the vitreous. Just look at that area very carefully. And if I just go back over here, just point out the debris which is moving over here. When you look over this area, you see there's some debris moving in the vitreous cavity. Looking with a superficial lens, looking with a 90 diopter, the retina seems pretty much okay. And initially on the first examination, I thought everything seems okay. The only problem patient was having was the pressure was 50 millimeters of mercury, and the patient was seeing that he's seeing floaters in front of his vision. So if you have a patient with floaters and a sulcus implanted lens, the next thing you want to do is make sure you ask the patient to look down and you look at the inferior part of the retina. And here we found out the main culprit of the problem. There's this red segment of a nucleus which is dropped. Those floating areas which the patient sees are in the vitreous jelly. Here are these strands over here. So this patient had a dropped nucleus in the posterior segment, which was causing all the problems and causing secondary glaucoma. As we move forward, you will see that you can see this area only by asking the patient to look down. And here you can see this is a whitish piece of cortical matter that's most probably from a white cataract. And the problem with these nuclei is that they tend to release this cortical matter in the vitreous, and that goes and plugs into the angle of the eye. If it was a nucleus sclerotic fragment, probably it would not cause that much uveitis compared to this type of whitish cataract. And that is why usually if it is very small fragment, you do not have to do anything. But if it's definitely causing uveitis, which is severe, and secondary glaucoma, then you have to go in and remove that nucleus. So the plan was to go in, do a pars plana vitrectomy, and if there's a small, softer nucleus, you can just get it out with a vitreous cutter and remove that, rather than going, or if it does not come out, then you can use a fragmentome to remove that piece of the nucleus, using higher magnification to just see those vitreous floaters in this patient. So it's very critical to see these patients and identify these whitish cortical matter. If I just rewind this area and bring this in front, if you just make a diagram of what we saw, was that if this is the eye and this is what we are seeing in this patient over here, if I just color this red, so this is the nuclear fragment which is fallen off, usually falls off and goes back. But when the patient is sitting up like this, and it will be over here. So you ask the patient to look downwards, and if he looks downwards like this, then only when you're looking with a 90 diopter lens, you will see it in this area. And you need to, and the main procedure you would go in with a pars plana vitrectomy, clear that vitreous out, and then go in and remove that with the vitreous cutter and clear the vitreous so all the debris is removed, and just close the vitrectomy on fluid. So that's the basic process through this. Thank you very much for watching.